All right, let's dive in. Today, we're tackling one of the most high-stakes challenges in all of medicine, vascular trauma to the neck. We're going to explore what happens when those critical pipelines to the brain get damaged and look at the incredible ways surgeons are pulling patients back from the absolute brink.
So let's just get right to the heart of it. What is it about an injury to the neck that makes it a literal ticking clock race against death? Why does it trigger this frantic countdown the second a patient rolls through the emergency room doors? Well, it all comes down to real estate. The neck isn't just there to hold up your head. It's this incredibly crowded, super vulnerable highway. You've got the carotid and vertebral arteries packed in there, the only pathways for blood to get to the brain. If those get hit, the biggest fear isn't just bleeding out. It's the immediate catastrophic risk of a massive stroke.
Okay, so to really understand what these surgeons are up against, we need to take a closer look at this unbelievably complex and confined anatomical space.
The official term for this is a cervical vascular injury. And you know what makes these so incredibly difficult is that they're often hidden. An injury here can be completely masked by other trauma to the head or the chest. And the scariest part, the symptoms might not even show up right away.
Now, these injuries tend to happen in one of two ways, and the difference between them is absolutely crucial for how the trauma team responds.
On one side, you have penetrating injuries. Think gunshots, stab wounds, where the damage is usually pretty obvious. But on the other side, you have blunt trauma, the kind of thing that happens in a high-speed crash. And these are the really sneaky ones, because all the damage is internal. The true danger can lie dormant for hours, maybe even days.
And the lethality here is just stark. For penetrating trauma, the mortality rate can shoot all the way up to 50%. I mean, a wound can just slice right through a major artery, causing catastrophic blood loss and cutting off the brain's oxygen supply, just like that. And for those who do survive that initial injury, a staggering 80% of deaths come from a stroke. So this brings us to the next, absolutely critical phase, diagnosis. Once a patient with a suspected neck injury arrives, how in the world do doctors figure out what's wrong when every single second is a matter of life and death?
Believe it or not, they start with a map. Surgeons divide the neck into 3 zones. Zone 1 is down at the base, near the chest. Zone 3 is way up high, near the skull. And then there's Zone 2, right there in the middle, and that's the one that gets hit most often. This simple map instantly tells a surgeon how hard it's going to be to get in there and control the bleeding.
Next, they look for what are called hard signs. These are the big, flashing red lights, the unmistakable clues that a blood vessel is in deep trouble. We're talking about pulsatile bleeding, where blood is literally spurting with the heartbeat, or a swelling that's just getting bigger right in front of their eyes. If they see any of that, forget about detailed scans. There is no time. That patient is going straight to the operating room, period.
And here's why they move so fast. A landmark study confirmed it. 97% of patients who show up with these hard signs have a major vascular injury. 97%. That is about as close to a sure thing as you can get in trauma care.
But what about those stealthy blunt injuries? Well, this is where we find something called a BCVI, or blunt cerebrovascular injury. Picture this. The force from an impact stretches an artery over the spine and creates a tiny tear on the inside wall. There's no external bleeding, but a blood clot can form on that little tear, break loose, and travel like a missile straight to the brain. And the stakes for missing a BCVI are astronomically high. If it's left undiagnosed and untreated, the stroke rate can be as high as 58%. This number just screams why aggressive screening is so critical, especially since so many of these patients have absolutely no symptoms at first.
Fortunately, this is where technology has been a total game changer. The new gold standard for diagnosis is the CT scan. It's fast, it's non-invasive, they inject a special dye, and a CT scanner creates this detailed 3D roadmap of the neck's blood vessels. It lets doctors see tears and blockages that, honestly, would have been completely missed just a decade ago.
So once an injury is found, what are the options? Let's take a look inside the modern toolkit that surgeons are using to fix these life-threatening problems.
Treatment usually falls into 3 main buckets. First, there's medical therapy, basically using anti-clotting drugs to stop a stroke before it can even start. Second is endovascular repair, which is a minimally invasive technique. And third, you have traditional open surgery. The right choice really comes down to the patient, the specific injury, and exactly where it is in the neck.
And this is where surgeons have to make some really critical tactical decisions. Endovascular repair is basically like fixing the plumbing from the inside. Seriously, They thread tiny wires and stents from an artery in the leg all the way up to the neck to repair the vessel from within. It's perfect for those really hard-to-reach injuries in zones I and III. Open surgery, on the other hand, is more direct. It's often the best bet for the more accessible injuries in Zone 2, where surgeons can physically see and reconstruct the vessel.
Now for those sneaky BCVI injuries, the treatment is a two-pronged attack. The number one priority is antithrombotic therapy, using drugs like heparin or aspirin to prevent a dangerous clot from forming in the first place. In more severe cases, they might put in a stent to reinforce a weakened artery wall. But no matter what they do, the goal is always the same: prevent a stroke.
So, with all these incredible advances in diagnosis and treatment, what's the real-world impact been? How has this changed things for patients in terms of survival and their quality of life?
The results have been nothing short of revolutionary. One major study looked at the impact of an aggressive CTA-based screening program. They found it slashed the time to diagnose the BCVI by 12-fold. And, as a direct result of that, the stroke rate was cut by a factor of 4. It just proves that seeing the injury earlier directly saves brain function.
When you put it all together, the combination of better, faster imaging and these less invasive repair techniques has completely changed the game. We're talking about patients who in the past would have almost certainly died or suffered a debilitating stroke, and now they're able to walk out of the hospital. It's truly amazing.
It's just a remarkable story of medical progress. That race against death that starts in the emergency room is now being won more often than ever before. It really makes you wonder, having made these huge leaps, what seemingly impossible frontier will trauma care conquer next?